What's going on, everyone? Happy Wednesday. Hopefully, everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive for COVID, flu, or any other virus, I hope you have a full and speedy recovery with no long term issues and no long COVID issues. It is time now for the Wednesday edition of the Virus Update for Wednesday, December 11th, 2024. If you're new to my channel, welcome to my channel. This is where I do virus updates on all those different viruses that can make us sick. COVID, flu, RSV, bird flu, yeah, that's becoming a thing. Measles, whooping cough, on and on the list goes. There are so many viruses out there that can make us sick, and you do not hear enough about them in the news. You need to be informed with what's going on with these virus levels. That's what I do here on my channel as needed, and we are doing it again today. So if you're new to my channel, subscribe down below. Give this video a thumbs up if you liked the video. The more people that hit that like button, the more YouTube's going to push this content throughout the algorithm. Let's try for 200 like button hits today, and of course, leave any comments down below. That helps as well, and of course, conversation is a good thing. I want to know what's on your mind. And share this video with anyone you know, and of course, hit that notification bell to be notified of my most recent updates that I do, which is not every day, but it is quite a few days out of the week. Alrighty, today we do have several news stories that we're going to take a look at. Then we're going to take a look at some daily data, and yes, we have to take a look at some EMS call volume today. Well, like we normally would, but last check, it has been very busy here locally in my area for ambulances, and I was listening to other areas on dispatch earlier. They are swamped as well. Yeah, not a good day there. And then we do have some new data, and I want to take a look at several wastewater sites today. So let's get into this, shall we? First off, on that Congo virus, most of the 416 infected, 31 dead from the mysterious illness in Congo are children. Yes, the WHO is reporting that most of them are children, and it is also starting to sound like there could be more than one virus involved here, though we don't know. There's still a lot we don't know, and apparently some of the testing samples, when they were going to bring them back or whatever, got damaged along the way. Apparently it is really hard to get to and from this area, so yeah, not good whatsoever. And it says, this BNO is reporting this, that 10 out of 12 samples from Congo's outbreak have tested positive for malaria. So BNO is reporting that the WHO is stating that further samples are being collected. It's possible that more than one disease is involved, as I said. So yeah, we're just going to continue to watch this unfold. Hopefully later in the week we continue to get more answers. It's coming in drips and drabs, and I know everyone's on the edge of their seat wondering just what the heck is going on with this virus. Alright, this is a very good data. Good in the sense that I'm glad we can get this data. David Christopher, who works in Northeast Ohio in a hospital, I don't know which hospital, but he works in a hospital, he did a short little thread yesterday talking about the post-Thanksgiving respiratory pathogens update. So this is for Northeast Ohio this week, 12-9, 2024 in Northeast Ohio. He says, we are seeing increases in positivity rates for RSV, 5.3% positivity rate there, influenza A, 3.3%, and SARS-CoV-2, 6.6%. Predominant SARS-CoV-2 variants remain KP3.1.1 at 50%, and XEC is at 30% of the lineages, and you can see in all of his charts. Here we go, here's the positivity rate for COVID. That is rising. Influenza is rising. RSV, wow, RSV is really starting to pick up the pace in Northeast Ohio, and here's other viruses, and you can see it is very active right now for viruses in Northeast Ohio. So that is from David Christopher. If you don't follow him on X, I suggest you do. He might be on Blue Sky as well. He posts wonderful insight on what is going on in his area. Follow that account. It really is a good account that you should follow. Alright, I found this really interesting yesterday. NYC Healthy, which is the health department in New York City, actually made a post on X about long COVID. I was like, what? They actually talked about long COVID. Oh, so many places try to just ignore it and not talk about it, but they actually made a post. So let's read some of it. Long COVID symptoms can be new, returning, or ongoing and are present for at least 3 months. COVID 19 vaccines continue to be the best way to protect yourself from severe illness from COVID 19 and health complications like long COVID. And they talk here about some of the symptoms which we have gone over many times before. Good time for a reminder though. Coughing or feeling short of breath. Been there, done that, continue to do that. Yes, I have that problem. Trouble thinking clearly or concerning. Brain fog. Once in a while. I can't say that has not happened over the last 4 or 5 years. It's happened a couple times, but it's not really a big issue for me. Trouble finding the right words, misplacing things, or changes in your ability to remember things. Dizziness or fast heart rate. A lot of people can relate to that. Sleep issues such as staying asleep or insomnia. I know several people who have that issue. Mood changes such as anxiety or depression. I know people who have that as well with long COVID. Always feeling very tired or feeling extremely tired after doing small physical or mental activities. Headaches, constipation, diarrhea, or other gastrointestinal symptoms. And the fact that they talk about GI issues, that to me just it's a good thing, but in my mind it brings back a memory from last year in January, well this year back in January, where I went to a GI specialist and they said, oh, COVID doesn't cause GI issues, your issues can't be from COVID. Well, right here, even New York City Department of Health is talking about that issues with taste or smell, and that's just a few issues. There can be over 150 to 200 different things with long COVID. It can go on to cause rare illnesses, rare diseases. You can be diagnosed with new things. There's a lot of things that can happen with long COVID. Speaking of New York, let's stick with New York for a second. RSV, COVID, flu cases are all on the rise in New York State. It's not just there, it's on the rise in a lot of places, but this article talks about RSV is on the rise and is affecting a lot of young children. Recent data from laboratories across New York show that positive RSV tests are increasing in New York City. RSV cases are significantly rising. There was a 22% increase in positive RSV tests during the week ending November 30th compared to the prior week. See, this is why about a month or two ago I changed the name of this video to Virus Update, because everyone used to see my videos and think, oh, COVID, COVID, COVID. Now, you can't just talk about only COVID. There are all these different viruses that can cause strain on healthcare, and it seems people can get them worse if they've had a COVID infection because of weakened immune system. It is a real problem, and it's a problem that's not getting any better. And we can see last season, this season, so last year around this time they were going up significantly, and it looks like the rise maybe started a little bit later this year, but take a look at this. It is rapidly going up for RSV in New York State at this time. We can see COVID-19, not a big rise yet. Give it another week or two, this will look different, and COVID will see a rise through to about the beginning of 2025. So, yes, the combination of viruses, that's what's going to cause issues on healthcare. And it also says here COVID-19 is picking up in the New York City area, where wastewater shows that levels are increasing. And take a look at this. Yeah, it's starting to pick up here pretty quickly for wastewater, so that is rather interesting. We'll take a look at today's New York State numbers towards the end of this video, and it says here, this is another article, RSV burden remains high in young children in the United States. Just wanted to read that headline. RSV, it is a real issue, and we haven't talked about it much lately. So today we did get some RSV news out to you. Alright, I put a poll out there on X yesterday after doing yesterday's video. I said, you know what? Let's take my questions from yesterday a step further. Do you know someone who caught COVID while using healthcare? It could be hospital-acquired infection while in the hospital, or a simple doctor's appointment. You know, you're going for a physical, or maybe you're going to the dentist to get your teeth cleaned, or whatever the case may be. And we got 297 votes, probably less now because with the migration over to Blue Sky and the post-election exodus of X, a lot of people left X. These polls are not going to get as many votes as they used to. I wish Blue Sky would really put in a poll, because I would love to be doing these polls on Blue Sky, because the COVID cautious community there is growing. But 79.8% of people said yes, 20.2% said no, out of 297, and many different people put here that they do know someone. Someone put, friend of a friend while in the hospital, she brought it home to her husband and child, and often COVID can be a domino effect. Someone picks it up in the hospital. They get released. They're still positive. They come home. No one's masking. Then the wife gets it. Then the child gets it. And on it goes. Domino effects. Or someone picks up COVID in the school, brings it home. No one at home shows symptoms yet. They all go to work the next day. Then the symptoms start a couple days later. Then people in the office start to get sick. You know how it goes, on and on. Well, he got it from him, and she got it from so-and-so. Yeah, it's that time of year once again. And yeah, it does happen that way, especially in healthcare. It really is a problem in healthcare. If simple high-quality masking, plus better ventilation and air qualities in healthcare was a thing, we could eliminate so many unnecessary cases. Sometimes someone has a simple fall, where they fall, they've broken their leg, they're admitted to the hospital. But then while they're in the hospital, they pick up COVID. And COVID's not the only thing you can get while in the hospital. You can get RSV, you can get flu, you can get all these different viruses. Simple masking and clean air can eliminate that problem. And guess what? By eliminating that problem, it can also help future healthcare capacity, because, a lot of these viruses can lead to long-term problems. They wouldn't need to revisit healthcare down the line for a problem that was caused by a hospital-acquired infection or a doctor's appointment or whatever the case may be. Moving on now, just your daily reminder that I do have a site, datareport.info, where I do talk about all these different viruses. Well, a lot of things get posted and archived on there, and it's not just me. There's other people that do post on my site, and hey, you can chime in on the threads, make a thread, and post as well. It is free to sign up over at datareport.info, or maybe you have a specialist appointment coming up soon for something that happened post-COVID. Well, guess what? You can do research. You can click on, for example, COVID's effect on the heart. Click on that and look here. If I have found a study or someone else has found a study, guess what? They add that into the archive. You click on one of them and it takes you right over to the study. There you go. It is that simple. Maternal COVID infections, many affected newborn heart development. Yes, if a mother has had COVID and gives birth to a child, it could impact the newborn. It is a thing. So, see, it's that simple. You can go do your research over there. All right, take a look at air qualities across the United States. Still bad in the west, bad in the east, really bad down around near Los Angeles and just to the north of Los Angeles. There are ongoing wildfires there that are very significant. Many people have been displaced from their homes. This is a really bad problem. You're likely going to see big time coverage of this on your national news today when you go to watch that. Want to learn more about climate and weather, where I will be talking about those wildfires just a little while from now. I'm going to post today's weather video, over at my Climate Data Report YouTube channel. I am definitely doing a video there today. All right, taking a look at the EMS calls in Philadelphia yesterday. I do need to refresh this and put it up there. Where is it at here? 794 EMS calls yesterday. I don't know what Philadelphia is going to come in for today. Haven't been listening to Philadelphia. I've been paying attention to the surrounding counties, which have been really, really bad today. And I've heard reports that hospitals are extremely busy in the outside counties of Philadelphia today. Montgomery County is now back down to 13 calls. I say the words back down. About an hour and a half ago, there were 27 active calls on this list for Montgomery County, many of them being respiratory emergencies. And air quality is an issue here today because of the weather that we've been having, but I've seen other things, and I'm still seeing. Look at this. Springfield, Montgomery County. Cardiac arrest going on. That's not a good thing. Let's see what's going on in Chester County. Whoa. Wow, this is really bad. Let's count the number of sick person calls that are within this. 1, 2, 3, 4, 5, 6. Okay, 6, 7. And then we're seeing a lot of respiratory calls there as well right now. This is really bad. I mean, look how many calls are here. There's a scroll bar that has popped up because there are so many EMS calls. This is what Montgomery County looked like earlier. During that period, Chester County was less busy. But earlier than that, you go back to this morning, and Chester County had a period just like this. So, I mean, yeah, this is concerning to see so many EMS calls, and I can actually show you this morning. There were multiple hospitals today diverting in New Jersey. I think it was 3 or 4, and someone says, well, there's 70-something hospitals. Okay, but we're starting to see it pop up. That's the point I'm trying to make. Pennsylvania, yeah, I had to make a post about this as well. Several hospitals in PA with emergency departments near or at capacity, and I can report to you that at least one of the hospitals that does not update on the map, I know someone who works, and they said it is really, really busy, and that it's pretty much a full house. So yeah, it is a real problem. Here's what Chester County looked like this morning, and well, as you saw now, it's even busier than that. And Maryland, I had to make a post about this too. I had to add another post in there into this thread. Maryland, a lot of yellow alerts, and yellow alert means that they temporarily request that it receives absolutely no patients in need of urgent care. And you can see it was among all the regions that had problems. There were some red alerts. This other region was not too bad, but take a look here. Yeah, a lot of yellow alert areas. So hospitals in Maryland are really busy as well. I wish I could give you more regions in the United States. I just can't do that. I tried typing in some states this morning. I typed in Illinois. I typed in Florida. Nothing was coming up. I'm sorry, folks. I mean, I wish we could see hospital diversion status in every state. That should be mandated, that it's public, but it's not. So, sorry, there's not much we can do about that. Taking a look at what's going on in Canada today, and we do see that the viral activity levels in Canada, I don't think it changed. Yeah, it did change. Okay. COVID-19 is moderate. Flu A is low. Flu B, which is now detected, is coming up as low. And RSV is coming in at high levels. Yeah, not good for RSV up in Canada at this time. National positivity rate from Walgreens for COVID is 15.2%. The prior week is 13.3%. Difference of 1.9% up. So yes, it has been going up. And let's just click on one or two states here. You know, some of those ones that we hardly ever get any data from. So we're going to do Arizona and Missouri. Arizona positivity rate is 21.3%. That is down by 6.9%. Prior week was 28.2%. Total tests, 258 versus 213. Missouri reports the positivity rate is 19.6%. Prior week was 12.8%. That's a difference of up 6.8%. Total tests, 107 versus 86. Now moving over to wastewater. In Coralville, Iowa, I was alerted to this, or at least I think I was. It looks to me as if the COVID levels here are now listed at high, and they are seeing a pretty large increase at this time. A little wonky movement at the end, but all of the charts that you're going to see on Wastewater Scan right now are having these wonky movements at the end. But overall, they were continuing upward. RSV, not a big issue yet. Influenza A is definitely rising. It's rising at a rapid rate. Influenza B, not much of an issue. HMPV is coming up 0, no detections. And norovirus is rising at this time. Everything else is not much of an issue at this time. Let's go somewhere else in the country. We've talked so much about the East. We've got to talk about the West. And take a look at this. Let's click on COVID here. The West is still listed at low for COVID, but we do want to come down to LA once again. And I believe there was a wastewater site in LA. How about Ontario? There was a wastewater site somewhere in California. I just saw it posted on X that is starting to rise. I guess it's not here at this time, but anywho, let's go down to San Diego. Is anything being reported there at this time? Okay, San Diego is starting to report a rise. RSV is seeing a rise at this time. Influenza A rising slightly, but then it did start to drop. That's good. Norovirus. Whoa. What is going on with norovirus here? Look at this. Norovirus over 100,000 pathogens. Please be super careful. Wipe down all surfaces if you are in that area. Taking a look at San Francisco. COVID is listed at medium in San Francisco. Not seeing a big rise yet. Remember, San Francisco in the summertime got hit super hard with COVID. So there may be some sense of immunity there, which would be some really good news because, again, San Francisco got really hard hit with COVID in the summertime. RSV is rising. That did not rise in the summertime. Influenza A is starting to rise at this time and is listed at high, and yet again another wastewater site with high levels of norovirus. That is not good to see whatsoever. Continuing on here, let's go near to Denver, Colorado. Let's go to the South Parker because this one's coming up high for COVID, and we can see here, yes, it is, there's wonky movement at the end, but it is starting to rise once again for COVID, listed high. RSV is low, but it is rising. Influenza A is starting to rise. Influenza B, not seeing anything for that, or HMPV. And wow, norovirus had some really crazy movements, and that is a really high level for norovirus. Extremely concerning if that is anywhere near accurate. Let's look somewhere else at this time. Let's go down to near Kansas City, and this is Call Point. This is in Kansas itself, not Missouri. And we can see here, low COVID, low RS, or medium RSV, excuse me. It does look like on the chart it would still be low, though, but they're listed at medium. Influenza A is still low, Influenza B is still low, as is HMPV. And norovirus, yep, listed high and starting to rise at this time. Also some detections of hepatitis A. And let's give you one more wastewater site. Let's go back into the Northeast. Let's see what's going on in Boston at this time. In fact, we're going to do another one after this. Got to give something for the South as well. And Boston, wastewater for COVID is high at this time. RSV, wow. RSV is really up there. That's a high level for RSV. Influenza A is low at this time. Influenza B is low. HMPV is low. Norovirus is high at this time. And everything else seems to be fine. Now let's go down south to Florida. Let's go way south into Florida. Let's go down to Miami, North Miami. We have not clicked on this in a long time. And low levels for COVID at this time. RSV, wow. RSV is really high and rapidly rising at this time. Influenza A is listed at high. Influenza B is low. HMPV is low. Norovirus is rising at this time. And we can see here there was a detection of Mpox back in September. And everything else, not much of an issue. Take a look at this. There are some detections of hepatitis A at this time. Now taking a look at what's going on in New York State for today. 477 new cases. That is higher than yesterday. And hospitalizations are higher than yesterday too. 503. And that is higher than any point from last week, the week before that. It's been a while since they've seen hospitalizations at 503, at least going back into early November. Patients in the ICU, 48 at this time. Alrighty, folks, that does it for the Wednesday edition of the Virus Update. We will have another Virus Update either tomorrow or Friday. If not tomorrow, definitely on Friday we'll get new CDC data. If you enjoyed this update, give it a thumbs up. Want to see more content like this? Just subscribe down below. I've been having way more viewers lately, and if you're a returning viewer and you haven't subscribed yet, just do that down below. Hit that notification bell to be notified of my latest update. Leave your comments down below and share this video with anyone you know. I will see you all again next time. Until I see you again next time, stay safe everyone, and have a fantastic Wednesday afternoon. Thanks for watching.